Some people may laugh about it, but snoring is really not that funny. It can disrupt your sleep and that of your spouse. And if you have sleep apnea and you stop breathing during the night, you have an increased risk of cardiovascular problems, such as high blood pressure or even heart attack. Doctors at Mayo Clinic are helping many patients with mild to moderate sleep apnea, and people who simply snore get a good night's rest. That's thanks to a special dental device.
It took just a few days to just adjust to that, but now, I will not go to sleep without it.
The IT that Sharon Swenson is talking about is a custom-fit dental device she wears at night to stop snoring and mild to moderate sleep apnea.
I would wake up at 2 o'clock in the morning, 4 o'clock in the morning.
Sharon was exhausted during the day. Her blood pressure was up, and because she was so sleep-deprived, it was hard to cope with pain from an old back injury.
Walking, standing in the kitchen, doing all of these things that I do routinely was impaired by the fact that I had sleep apnea.
You see, sleep apnea and snoring can happen when your tongue and soft tissue collapse during sleep and obstruct your airway. CPAP machines push air in to keep the throat open.
Most people do well with CPAP, but those who don't love these things.
Dr. Kevin Reed says this dental device is custom fit to your mouth. It works by very gently and slightly pulling the lower jaw forward to keep the airway open.
These are very effective in reducing snoring, primary snoring, even in the absence of obstructive sleep apnea.
But before you get one of these devices, Dr. Reed recommends you talk to a sleep physician. That way they can determine if you have any conditions associated with sleep apnea, such as cardiovascular disease. That's what Sharon did, and now her blood pressure is down, back pain is improved, and she's much less tired during the day.
I am so relieved to be able to get a good night's sleep.
Dr. Reed says these devices should be fitted for you by a dentist, and because they very minimally move your jaw forward, your bite may slightly change over time. Sharon says that's a small price to pay for a good night's sleep and improved health. For Medical Edge, I'm Vivian Williams.